Venous insufficiency is mainly affects the lower limbs. If you look at your veins and think that they are like a tree with trunks and branches and twigs, you have a superficial system of veins just underneath the skin, and you have a deep system of veins deep within the muscles. These carry blood back to your heart from your legs, and these veins have valves in them that should only work in one direction, in that blood should only go from your legs back up into your body. Venous insufficiency happens when these valves stop working and blood passes not only up into the body from the legs, but also back down the legs. This means that the lower leg has more blood in it than a leg where there is no venous insufficiency. And so the most common symptoms of venous insufficiency are a heaviness in the leg, aching, discomfort, and swelling. And if things progress, if the venous insufficiency is particularly bad or it's been there for a long time, patients develop further symptoms such as itching of the skin. They can develop some changes in the colour of the skin around the ankle or in the calf, where the skin becomes a brown colour called hemosiderin, or they can develop particularly bad changes with pain, and then the final outcome is a leg ulcer. The early stages of venous insufficiency, the patient would notice an achiness and a heaviness in the leg, perhaps at the end of the day, if they have a job where they're standing or walking around. And then the next stage after that is itching of the legs. If a person has venous insufficiency, then they require a careful assessment by a specialist in vein disease or phlebology. And that would involve a careful history, a clinical examination, and a venous duplex ultrasound scan to look at the veins underneath the skin and to look at the veins deep in the leg to determine whether the valves are working or not. And with that information, we can then tailor the treatment based upon the patient's specific problems. There is no particular diet that is useful for venous insufficiency other than a lifestyle modification. For example, not being overweight and exercise. These will help to reduce the risk of venous insufficiency. And the other issue is with prolonged standing, one might benefit from wearing some knee-length compression stockings. Venous insufficiency is curable and reversible. The commonest cause of venous insufficiency is affecting the superficial venous system. These can be treated with a number of techniques, predominantly minimally invasive techniques, where the vein insufficiency is treated by obliterating the vein, either using heat or by using a chemical to block the vein. This isn't so easy with deep venous insufficiency. There are some patients that will have problems with the deep veins and the valves aren't working that will improve when the superficial veins are treated. The other issue when we talk about cure is that if you are a person who has varicose veins that are causing your venous insufficiency, we know that regardless of the type of treatment that we use, whether that's minimally invasive treatments or conventional surgery, for example, there is a 15% risk of new veins developing at 5 years.